There are many traditional cultural practices being followed in our country from time immemorial in the care of the young babies. Many of them are beneficial, but there are a few practices which have been scientifically proven to be harmful. Although all pediatricians tell their patients about it, yet we very often find them being put into practice. Hi, this is Dr. Kiran Sodhi welcoming you all to my channel Pediatalks. Please subscribe to my channel and like and share this video so that more parents can benefit from this information. In today's video, I shall talk to you about a few such practices followed in the care of the young infants which should be stopped completely. One such practice is the application of kajal. Babies are applied loads of kajal on their eyelids as an attempt to ward off the evil eye. Another reason given is that it increases the size of the eyes and improves the eyesight. There is nothing but harm associated with kajal application. So what are the harmful effects? It can lead to eye infection due to the applicating finger or stick carrying the germs which go into the eye, or because the thick kajal may block the tear ducts leading to infection. It may irritate the eyes due to allergy to the kajal, leading to watering and redness in the eye. The application process itself may cause injury to the eye, as the baby is mostly very fidgety and restless when any manipulation is done on their eyes. Many kajals may contain heavy metals like lead in them. The soft membranes over the eyeball make its surface very absorptive, and from here these metals can get absorbed into the body, leading to their toxicity. Use of talcum powder. Talcum powder is very frequently used in babies after their bath or otherwise for a fragrant smell and as a soothing layer over any rash, especially diaper rash. And how can it harm? Well, the talcum powder is often sprinkled over the baby's body and face. During the process, the talc particles get airborne and can be inhaled by the baby. They can thereby get lodged deep into the lungs and the air passages, resulting in a variety of pneumonias and breathing issues. Many studies have taken place where they have found heavy metal particles in some talcum powders. Inhalation through the nose and absorption through the skin can cause toxicity by them. Very commonly, talcum is sprinkled over a diaper rash, but instead of improving, it can actually cause worsening, as the skin in the area of diaper rash is often broken and the talc application traps the moisture beneath it. Similar effects can take place when we apply talcum after a bath. If the body has not been completely dried, then the application of talcum traps the moisture, leading to rashes. So in case, for the sake of a good smell, you do want to apply talc, remember to buy a product proven to be safe for babies after reading the labels about what the talc contains. Secondly, never sprinkle the talc over the face or body. You can take a small amount in your hand, rub it in them and apply over the body, avoiding the face, armpits and the groin. Prelactal feeds refer to the first feed given to the baby even before giving milk. Traditionally, it was thought that adequate breast milk is not produced for the newborn baby in the initial few hours, so babies were fed things like honey, top milk, water, and even tea was given to them soon after birth. This concept should be completely abandoned, as nature has a very robust system wherein soon after birth specific hormones are produced which start breast milk production. Harmful effects of prelactal feeds are that it may actually delay the process of breast milk production. The sticky milk called colostrum that is produced for the first 48 hours of life is extremely rich in antibodies and proteins. By giving prelactal feeds, we deprive the baby of this elixir that is so necessary for development of their immunity. The external feeds that we give may not be gentle on the baby's tummy, leading to problems like indigestion and infection. Foods like honey are known to cause serious diseases in the baby, so should never be given. Oil is often dropped into various orifices and crevices of the body, like the ear, nose, and the navel. The reason postulated is to provide lubrication to these areas. Oil is even applied in abundance over the anterior fontanelle, which is a soft spot on the scalp of the newborn and the young infant, with the reasoning that this oil keeps the brain lubricated. Please remember, these are just orifices which lead to nowhere, and whatever we add only collects there and causes problems. Oil put in the ear cavity over several days and weeks only leads to its collection inside the ear canal, leading to thick wax collection, which sometimes requires medical intervention for removal. The oil may trap moisture and lead to growth of germs and abscess formation in the ear area too. Administration of oil in the nose has risk of oil droplets being aspirated, leading to choking and breathing difficulty. Oil may also block the nasal passages and cause various allergies. Putting oil into the navel only produces infection due to blockage of the sweat glands. Oil application over the soft area of the scalp is of no use except for producing infection and skin allergies. Additionally, inserting fingers or applicators into the orifices to apply the oil carries the risk of injury to these areas. Janam Gutti is a herbal medication that has been used since ages. Some of its ingredients may have some carminative properties which aid in digestion, reduce gas, thereby reducing incidence of colic. Some herbs in it may have a calming effect on the baby and may soothe them temporarily. However, it has its own harmful effects. Firstly, as there is no scientific evidence of its benefits, why give it? There are many brands of gripe water and Janam Gutti, and the constituents may be different across them, so no one can never be sure of what they contain. However, if you are convinced that this works wonders for your baby, please use it sparingly and only after consultation with your pediatrician, whom you may like to show the ingredients once. If your baby is prone to colic, it is better to try home-based methods for both prevention and treatment. Please check out my video on this topic by clicking the I button. Balms are very commonly applied over the skin of the chest and nose during a cold to improve breathing by removing the nose block. However, most of these balms contain camphor, eucalyptus oil, terpene oil, which may actually be harmful. Camphor especially is known to cause toxicity of the nervous system, wherein children may become lethargic, develop abnormal movements and even convulsions. As it is, balms have no role in colds. Nose block, if present during cold, is best treated by use of saline drops. Thank you and happy parenting. Please visit my channel for many more such videos which will help you immensely in your parenting journey.